All right, so some of the challenges that we face on calls are safety for ourselves and the crew. Depending on the scene and the circumstances, it is a type of load and go kind of environment, and we may need to just scoop that child up and get them into an environment where we can do an assessment quickly. But eventually we do need to do a head to toe for this child. We need to kind of strip and flip this individual. I kind of think of it as an unconscious adult. When you've got, that's pretty easy to do, and you tell somebody that on scene, hey, we need to strip and flip this, then it's everyone's on the same team, everyone's got trauma shears, and they're cutting and they're looking for what had happened.
Right, I imagine it gets very challenging because you have, I mean, this baby luckily is laying here, but of course an 18-month-old, usually if they're awake and screaming, they're clawing at mom or clawing at you, so it gets really, I imagine it gets super, super hard to get that information. But the information that you guys give us depends, it impacts what we do when you guys come to us, right? Why sometimes the information that you're able to provide for us, sometimes you get to the hospital and there's 20 of us in gowns waiting to go, or there's, you know, nobody around and everybody's very nonchalant. So it's all based on that information you guys are able to give us. But this is a great understanding for me to know that you guys deal with different things in the field than we deal with in a controlled environment.
Exactly, and sometimes on these load and go patients or these load and go calls, you and your partner do get separated. They're taking care of family, you're taking care of patient, and sometimes, quite often, that individual is doing the call-in for you because your hands are tied in the back of the ambulance to try to figure out what's going on. So I think it's better for us to understand too, maybe it's more important to gather that information to pass along to the team waiting for us so they know what's coming through the door rather than just, hey, we're on our way and we're not really sure what we have at this point.
So Matt, tell me how does that information get relayed? Like, are you guys come together as a team, or how is it that who does the call?
Again, it's very call dependent, and then depending on how many people we have at the scene. In a perfect world, in a perfect call for me, I'm doing the assessment and I'm making the call, or I'm doing the assessment in front of the individual making the call, right. Whether that's the AMR paramedic or my partner that's outside. But again, we don't get that chance every opportunity.
I guess that explains why sometimes we'll get a whole lot of information, or we'll get it like 20 minutes before they get there, or we get like a 30-second call, which honestly, I think however long it would take you guys, probably the best bet for our end of it is to get as much information, even if it's, you know, a minute out, rather than even if we get it 20 minutes before, but there's not a whole lot of information, then we're not ready for you. We're not ready for that patient to come in.
Exactly, and hopefully Gigi can show us exactly kind of what they're looking for that information so we can collect it, gather our thoughts, let them know before we walk through the door what they're going to be seeing.